Hey, you guys, welcome back for another review of our antibiotics. We're covering them all month long. And as promised, we are going over macrolides. For those of you who are familiar with me, hey, y'all, welcome back. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I design these videos and resources to help nurses and nurse practitioners be successful on exams, boards, and practice, okay? And with feedback from another series I was doing as we were studying together, antibiotics was one of the things that was requested. I did a quick, short, and sweet video that if you haven't had a moment, take a chance and go look at that to kind of hit the major, most common antibiotics that we typically see on exams, as well as that we typically utilize and prescribe for our common diagnoses that we see. But um, there were still some more questions, so I went a little bit deeper to break it down into bits and pieces so that it's like bite-sized pieces so that you can retain and then apply it to the sections that you're studying on a system by system basis. So there's the full video I'm talking about. Then I did the gram positive and gram negative, bacteriostatic versus bactericidal, and then now we have been breaking it down into these groups so you can see the ones that are on tetracyclines and then macrolides, and then we'll continue on with our fluoroquinolones, our sulfonamides, as well as our cephalosporins and penicillins, right? All right, let's get into the material. All right, macrolides. I always tell you guys to know the endings. So macrolides end in mycin, MYCIN. So you know your azithromycins, your clarithromycins, your erythromycins. Those are your macrolides. These are considered bacteriostatic antibiotics. Y'all know I've talked about this. Static, remembering, meaning to stop the growth of the bacteria, right? Because static means to be still, to stop movement. So to stop the growth of that bacteria that is fighting. Macrolides are typically utilized to fight gram-positive bacteria as well as those atypical bacteria. If you stop and think about it, we commonly utilize macrolides for the treatment of atypical pneumonia. So, bacteria common like that. So, thinking about your gram-positive bacteria is remembering your staph, your streps, including that strep pneumoniae, your enterococci. Those things are utilized. Those are the bacteria that macrolides are utilized towards. Common GI, respiratory, things of that nature. But like I said, those atypical bacterias like that, like those the atypical pneumonia, and your mycoplasms, and those are where you will see these commonly utilized. Again, remembering the ending of the mycin. Also remembering, as I always tell you guys, when you're dealing with a bacteriostatic antibiotic, making sure that you pay attention to that patient's immune system. If they're immunocompromised, you have to weigh your benefits versus the risk, because when it's bacteriostatic, it is working to stop the growth of the bacteria. So it also needs to be ways that that bacteria and infection can be completely resolved, right? And if you're completely immunocompromised, then your immune system cannot work to help as much as we would like. So keep that in mind. Some things to consider when advising your patients, if you're prescribing this, or also thinking of certain situations before prescribing these medications. Macrolides can cause some GI distress. So in those nature, informing them like light uh, food items before taking the medication, because it is one, antibiotics can be harsh on the stomach, so it can cause some GI upset. um, Now, do let them know that just there's a variance in GI upset and distress. If they are having excessive nausea, vomiting, diarrhea, to notify their provider, because they may need those medications rotated, right? Um, for example, if it's causing this many disturbances, and being that macrolides are commonly utilized for the treatment of like atypical bacteria, it's not many things that work towards those. So you have to keep that in mind. So in these cases, a lot of times that this macrolide may be more beneficial than the risk of the vomiting or diarrhea. But if you want them to continue to take it, and you don't want to have this extreme GI distress. So with that, if they're on, say, clarithromycin, uh, taking them off of that and starting them on azithromycin um, may pose a little bit better, maybe a little bit better for that patient. And they may tolerate it better. Their GI system may respond better, is what I'm trying to say, to those. So sometimes just rotating out the macrolides instead of uh, discontinuing them completely is the best option, especially for the treatment of these atypical bacterias. It can also lead to ototoxicity. So if they're complaining of hearing changes, keep that in mind. And then another one that's huge is that QT prolongation. One, if they have a history of QT prolongation, then you really have to tread lightly with considering to even start them on that. Also, if they're taking Coumadin, things like amio, like your amiodarones, and things of that nature, those drug interactions can also lead to QT prolongation. So be sure that you are closely monitoring the medications that they are currently taking, or and also their cardiac history. If they've had a history of QT prolongation, if they have a current history of QT prolongation, you want to pay attention to all of those things when prescribing those. All right, so I know I just said it like a mouthful, so I'm gonna start from the top and give you a brief synopsis of all that again before we wrap this up. Okay, so remembering macrolides end in N-myosin, MYCIN. Those are like your erythromycin, azithromycin, clarithromycins, right? They're bacteriostatic, meaning they stop the growth of the bacteria, making sure that we're paying attention if the patient is immunocompromised or not. These are commonly utilized for the treatment of gram-positive bacteria and atypical bacteria. It can lead to some GI distress. In those cases, try to rotate out medication to see if they respond better to different macrolides. Ototoxicity they may have as well as QT prolongation. Be sure to pay attention for drug interactions. So, looking at those cardiac meds, if they are on any medications, such as like amiodarone, any arrhythmics, you want to look closely at those because of the possibility of this medication of macrolides causing QT prolongation. Coumadin definitely is a drug interaction for macrolides, so you want to weigh your benefits versus your risk. Okay. And that is the short and sweet of the macrolides. If y'all have questions, as always, please feel free to put them in the comments so that I can go deeper. If you want me to go a little bit deeper in this material, if you need examples, let me know. We will be doing questions on these antibiotics. I just want to slowly give you more information before starting to do practice questions on these. Okay. So again, tetracyclines, macrolides, bacteriostatic versus bactericidal, gram positive versus gram negative is what we have covered thus far, but I will get into some more of that and then we'll get into the practice questions. Okay. All right, you guys. As always, thank you for watching. Be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial. But be sure to meet me back here for more topics and review of the antibiotics. If you are looking for other things, be sure to check out, there's over 140 videos here on the channel of everything to get you prepared for boards. If you're looking for something more detailed and more specific and designed specifically for you, give us a call at 803-400-6864 at the Nursing Studio, or you can shoot me an email at thenursingstudio1@gmail.com. Look forward to talking to y'all. Bye, y'all.